Thank you for joining us again today. In this episode, we're going to be talking about treatment options. I've recently been told that I have cancer, and what are the options that I have? How do I go from where I am at the moment to a place of health or a place of happiness or well-being or healing?
I do believe a holistic approach is really important to care for your body, mind, and soul going through these treatment experiences. In terms of the treatments aimed at or targeting your body, I can comment on the Western medicines. I do want to acknowledge that those are not the only treatments that are available, and you have to choose something that is right for you and your circumstances.
So of all the various treatment options that we have available, which is the best? I want the best care for myself or my loved one. What's the best?
The best treatment is the one that works for you the best. It's again a discussion between yourself and your treating team as to what is the best option for you at that time with the knowledge that you have at the time. One of the frustrations is that you never know how a person is going to respond to treatment. Perhaps a patient will have the first one or two treatments and you see a great response, those tumors start shrinking markedly and everyone is very joyful. That's not always the case. And it's to try and find the perfect treatment for yourself based on the gold standards, based on the international experience.
So there's no one pathway that is the best fit. So for example, chemotherapy is the best treatment for cancer, or radiotherapy, is that not the best treatment for cancer? There's no one answer to the solution.
Certain cancers respond better to certain treatment modalities. And so your doctor who would be experienced in treating patients with cancer would be able to make a very informed decision based on your needs as well as to what the best recommendations would be for treatment. And a treatment plan would be designed for you personally. And that may include one modality, in other words, just surgery or just radiation therapy or just chemotherapy. But more typically, you're offered combination treatments. And that's where it becomes quite interesting and very scientific, I might add, because the doctor would say, I want to give you chemotherapy first to shrink tumors as best as we can, so that I can go in as a surgeon and just remove a much smaller tumor, as opposed to starting with surgery first when you have this very bulky tumor to try and remove. The combination of treatments are very important because the one treatment can enhance the effectiveness of the other treatment type, the order of which is very important. If you are only going to get systemic treatment, you might get more than one different type of systemic treatment. So for example, you might be offered chemotherapy and hormonal therapy. You might be offered chemotherapy and immunotherapy. These drugs work together to try and target the tumor most effectively.
How often would it be appropriate to have an intervention on a treatment path? If I'm on a specific pathway for the treatment that I'm on and I feel like it's not best suited for me, and there may be a different pathway that may be more beneficial, how often are doctors likely to adjust the treatment paths as we walk down them?
Again, very individual and very dependent on response to treatment. So after you have started a particular type of therapy, say for example after 3 months, the doctor might want to see how you have responded to that treatment. And that would typically be through a scan or some sort of an image to see if the tumor has started shrinking. In the case of certain diseases that are in the blood, it might be with blood tests to see if the tumor burden in the blood had started decreasing. So definitely one of the very important things is after you started treatment, there would be routine surveillance throughout your treatment program to see how you're responding to treatment, if the treatment is still effective or if something needs to be changed or something needs to be added.
Would it be possible for me to be able to tell that my doctor has put me on a treatment path that is maybe not correct for my prognosis because my prognosis is worse than what he's telling me?
It's a very difficult question to answer. Whenever you are diagnosed with a life-altering disease, I think it's very important to get that second opinion. One, because I think it would bring you quite a lot of comfort to know that there's an agreement between the two doctors that you are on the correct path as best as we can determine. It does become a little dangerous when you start shopping for cancer care specialists, because there may be slight nuances in opinions between the various treatment specialists. A question that I'm often asked is, who is the best doctor to go to? And my answer will always be the one you trust the most.
Is there a specific side effect, a specific thing that I can expect as a patient on specific pathways of treatments that my doctor has put me on? What can I expect once I've now been given this treatment pathway?
It becomes a whole world of not knowing, because it is such an individual response. There are a lot of side effects to treatment, as you can imagine. Localized treatments mostly cause localized or locally experienced side effects, whereas the systemic treatments, these side effects, which are numerous, tend to be systemic. I think it's important to know that side effects can be managed, and they are managed by your treating team. Some will find a particular side effect really bothersome, and it becomes actually even more worrisome than the actual treatment, while others can hop, skip and dance through treatment without a side effect of note. The important thing to always remember is that there are treatment options to help control those side effects, and as soon as you experience anything that you're having difficulty with, to speak to your treating team and allow them to assist you.
Rowan, a few of the treatment options that you have mentioned deal with sort of taking chemicals, something along the lines of chemotherapy. That's often a buzzword that we'll hear and we kind of trigger on. What can I expect if that is a treatment path that I'm going to be taking? What am I going to be feeling?
Well, let me give you an example of being treated with chemotherapy, and even chemotherapy made up of an assortment of different chemicals. It's often not just one particular medicine type, but lots of combinations of treatments. But chemotherapy works against cells in the body which are growing quickly, not discriminating between healthy cells and unhealthy cells. And so cells that are healthy in your body growing quickly, for example, your hair grows quickly, and chemotherapy will target those cells in your body growing quickly, and your hair may thin and it may fall out. And you may lose all of your hair on your body, or you may only lose in clumpfuls in certain areas. Other healthy cells in your body, which are hurt by the chemotherapy, are the cells of the lining of your inside skin, your mucosal membrane, the cells of the lining from your mouth to your anus. Those are cells that are really growing quickly, and the chemotherapy targets cells in your body growing quickly. So having had chemotherapy, you may experience a sore throat, sores in your mouth. You might experience a sore gut. So we've spoken about chemotherapy and just a few of the side effects and the reasons for those side effects that could be experienced. But if you take a different treatment modality, such as immunotherapy, immunotherapy is designed to work on your immune system. So the side effects that you experience are those of an immune response, allergic reactions, hypersensitivity reactions, because your immune system is not sure what's happening with these treatments inside and treats it as something abnormal. Hormonal treatments have their own side effects, and ask any woman who's gone through menopause with hot flushes and sweating inappropriately and weight gain, etc. So each of these different types of medication types come with their own profile of potential side effects, and even with those potential side effects, there's no guarantee that you will experience each and every one of them. Thanks for tuning in and watching our video. If you have any questions, comments, or even suggestions on what you'd like to see in future content, please leave them in the comment section below, and we'll get back to you as soon as we can. We're here to support you in your journey to learn more about cancer and how to manage it. Join our community and empower yourself with knowledge and resources to make informed decisions about your health.